An 8-month-old boy is brought to his pediatrician due to recurrent episodes of pneumonia. He was born at term without complications. His growth and development are normal. His mother reports that he has had several previous infections since turning 6 months old and has been treated with antibiotics each time. On examination, the patient is afebrile and the laboratory studies show hemoglobin 12.6 grams per deciliter, leukocyte count 8200 per millimeter cube, immunoglobulin levels, low levels of IgG, IgA, IgM. Which of the following tissues would most likely have a normal biopsy in this patient? Choice A, spleen. Choice B, lymph nodes. Choice C, appendix. Choice D, bone marrow. Choice E, submucosal lymphoid tissue in the ileum. I'll wait 5 seconds and then start answering this question. The diagnosis here should be fairly obvious. This kid didn't have any issues until 6 months into his life, and then he started getting repeated sinopulmonary infections. And obviously the lab values also tell you that he has low immunoglobulins, so obviously this is some kind of B-cell deficiency. So this is a pretty straightforward diagnosis of Bruton's. You of course need to know that this is an X-linked condition, although the fact that it's called X-linked agammaglobulinemia should probably be a hint for that. And in this condition you have a mutation in the BTK gene. And the extra step that exists in this question is that you need to know that this mutation makes it so that the pro-B cells cannot turn into pre-B cells. This is a process that occurs in the bone marrow. And because this process is disrupted, the pre-B cells do not ever leave the bone marrow. So that's why in Bruton's patients, they will often, in question stems, they'll always talk about how they might have scanty lymph nodes. But for the purposes of this question, what you need to know is that if I don't really have the lymphoid tissue, then obviously if I go biopsy those tissues, I won't see anything normal. However, in the bone marrow, I can't actually differentiate between pre and pro B cells, so it's actually going to appear normal. So choice D is the correct answer. Every single other answer choice here is a lymphoid tissue that normally has a bunch of B cells in them. The spleen has both T and B cells normally. You wouldn't really see the B cell areas, or they'd be atrophied or something. And the same thing goes for every other answer choice. As I said, lymph nodes, they would be atrophied. Appendix usually has a lot of lymphoid follicles, but that doesn't exist because you don't have B cells. And choice E, obviously I just wrote essentially pairs patches in different words. These would also have a bunch of lymphoid follicles that include B cells, and in Bruton's, these are underdeveloped. So your takeaways here are obviously know how to identify Bruton's, and also recognize the general maturation pathway of the B cells, which would have allowed you to answer this question. Hope this was helpful. I'll see you in the next video.